All right, I think we can go ahead and get started. Thank you everybody for joining the Know Before They Go Health and Safety webinar. We really appreciate you taking the time out of your busy day or your evening to join us to talk about these important and timely topics, health and safety in study abroad. We're also very excited to have your students going abroad with us in the spring or the summer. We're very excited to get study abroad back and rolling with more students coming abroad with us in the spring. Kayla, if you could go to the next slide. Okay. My name is Erin Kadinsky, and I'm the Director of Health and Safety with CEA. And I want to take a couple of minutes for my co-presenters to introduce themselves to you also. So we'll start with Hannah.
Hi, my name is Hannah Sutton. I'm the Manager of Health and Safety.
Hi there, I'm Kayla McGuire. I am the Site Specialist Team Lead here in Enrollment.
And again, I'm Erin Kadinsky, the Director of Health and Safety. And I've been with CEA just for a short time, actually, for about 5 months. But I have worked in study abroad for around a little over 15 years. And most of that time was spent working in health and safety. And so I have a lot of experience with helping students through difficult situations abroad, working with our on-site staff, crisis management and risk management also. While our headquarters is based in Phoenix, Arizona, I am located in Indianapolis, Indiana, and Hannah also is in Indianapolis with me, and Kayla is in our Phoenix headquarters. Go to the next slide, please. Okay, we have a very packed agenda for you today. We've planned about 30 to 35 minutes of information to share with you regarding various health and wellness and safety topics within study abroad. But we also want to leave plenty of time for you to ask your unique questions to us. So we've saved the last half of the webinar for you to ask those questions. You can type in your questions in the Q&A box or the chat box at the bottom. And we'll try to answer a few of those as we go along, but we'll probably save the majority of them for the last half of the webinar. And if you wouldn't mind to try to keep your questions focused on health and safety, those types of concerns for the study abroad programs. And if you have any additional questions about enrollment or the application process or program-specific questions, then we ask you to contact the enrollment team after the webinar. And we'll be providing our contact information too, so you'll be able to do that. And just so you know, this webinar is being recorded, and we will send out the link to the recording to you afterwards. So you'll have it for your records and you can refer back to it if you need to. Now I'm going to hand it over to Kayla, who is going to talk a bit more about CEA.
Perfect. Thank you, Erin. Hi, everyone. So just a little bit about CEA that we wanted to cover. CEA has been a leader in international education since 1997. As that international organization that's dedicated to global ed, CEA does embrace diversity to cultivate respect and inclusion and academic excellence, both with our staff and faculty and with our students. We believe that exposing students to a very diverse set of cultures, ideas, and people will prepare students to make a more positive impact, both at home and abroad in their local communities. As you can see, we do have staff both, here in the US, kind of all over, as well as in each of our locations. So we have our on-site teams. So you can see some of the many faces of CEA, whether they are here in the US or whether they are on-site. Really, we are all one team that is here to help best prepare the students before they leave and have the term that they're looking to have once they arrive on site. So we all work together to provide that for them. You can see here that we do have quite a number of destinations for our students to choose from. We have programs that are suitable for almost every major in 13 countries and 22 cities around the globe. We also do offer internships in about 15 of these locations. So very possible that your student might be participating in one of our internship programs as well. So whether the student, that you have is looking to either study or intern, they can decide on a year program, a semester program, a quarter program, or even a short-term summer program. They're definitely going to find a very wide variety of courses really that are available across all of our locations. And we really work to satisfy academic, personal, and professional goals. So really rounding out that entire experience is what we're looking for. Wanted to just touch a little bit on what is included in a CEA program. Of course, as you can see on the slide here, quite a few things, but namely wanted to mention the personalized pre-departure advising. So that is the team that I am on here at CEA. The enrollment team is here to help with things like course registrations, filling out housing applications, and getting student visas, just to name a few. But then I did want to hand it over to Erin or Erin and Hannah, as we are focusing on health and safety and the inclusions that CEA has with all of our programs here today. So Hannah, I will give it over to you.
Awesome, thanks, Kayla. So as Kayla said, a big part of what your students are getting through their participation on a CEA program is dedicated advising, and that includes health and wellness and safety advising. There's a lot of information that students have access to in their My CEA portal, but we also have resources available on the health and wellness page of our website that you can access anytime as well. So in addition to your students reaching out to us with any questions or concerns they have, you'll always have access to resources online, and it's great for students and families to start thinking about their health and wellness needs for their time abroad sooner rather than later. So we recommend that everybody take a look at those resources as soon in the next couple of months. Students will soon be asked to complete a health information form, and this form is really designed to help us help your student. The information that students will disclose on that form is kept confidential, but we'll use that form to really prepare students and make arrangements for any necessary services or accommodations abroad. So if your student needs to set up regular appointments with a doctor, we can work with them to start setting up those appointments in advance rather than trying to do that on site when the excitement of the first couple of days is happening. It's always good to get those things sorted out earlier rather than later. So that health information form will allow us to gather that kind of information to work with your student to support those needs. The form also will help us to anticipate complications that your student might encounter. So if a student is taking a medication, for example, that might be considered a controlled substance in their program location, we can flag that for them and discuss what that means and what steps they need to take or what information they need to be aware of to prioritize their health and wellness needs as it relates to their medication. And then another part of what's collected on that health information form will allow us to look into potential accommodations a student might require for any medical or health related special needs, such as learning disabilities or mobility considerations, to name a couple. We can advise students on what might be available in their program location, but it's always important for students and families to keep in mind that the accommodations that are available in their program location might look a little bit different from what students and families are used to in the US. While we can't guarantee that a specific service or accommodation can be matched out on site, we would always work closely with your students to support them and what their needs are to set up some appropriate accommodations. Go to the next slide, please. All students are going to be covered through an insurance policy with CISI insurance while they're abroad. This insurance policy is included in the program fee and students are automatically enrolled. So there's nothing that you or your student needs to do to set that up at this time. And the policy is going to cover most standard medical care needs that students will have while they're abroad, such as doctor's visits, trips to the hospital, or emergency situations. And that policy will also cover some pre-existing conditions and mental health needs to a certain extent. So most students find that the CISI insurance that they receive is a pretty comprehensive insurance plan for their time abroad. There is a $25 deductible for medical care, and students will need to pay upfront for any medical bills or services that they receive at the time of their appointment. Then students will file a claim for reimbursement with CISI. And our on-site staff can always help with this process. That's what they're there for, to support students in those types of needs. So students don't necessarily need to memorize the process ahead of time. Our staff will be able to support them if they do find that they need to access insurance while they're abroad. And then, so you're aware, if there is some sort of an emergency situation, students, CISI and CEA can work with the hospitals to set up any direct billing. So students aren't going to have to worry about big emergency medical bills, paying those out of pocket. If there is some sort of an emergency, we can set up that direct billing to ease your mind on that piece of the process. And then during times of COVID, there's always some additional considerations to think about when it comes to health and safety and insurance. CISI does include an additional trip delay, trip interruption, and quarantine benefit for the upcoming terms. So if at the end of the semester or end of the summer term, your student tested positive and was not able to return to the US and had to stay in their program location to quarantine or self-isolate, they could file for reimbursement with CISI for some of those expenses to potentially get a reimbursement. So you can read more about what's covered on the plan and potential exclusions and things like that through the brochures that are all available on the CISI Health and Wellness page, CEA Health and Wellness page. Here, the next slide, please. Thank you. Here we've got a few top tips that students and families should be thinking about for the pre-departure phase. So students should be talking to their doctors and current healthcare providers, taking care of those annual checkups and things like that before they go abroad. We also recommend that if your student sees a counselor or a therapist and wants to continue that kind of support abroad, that they reach out to their current mental health care providers to see if those providers can do online counseling. While we can certainly set that up with them, students can find a local counselor in their program location if they'd like. Some students find that it's helpful to continue on with their traditional provider if that's a service that their doctor or counselor can provide for them. So definitely something to be looking into. As I mentioned, the CISI insurance plan is pretty comprehensive, but depending on your student's needs, there might be a need for additional insurance. So it's always a good idea if those are your circumstances to talk to your normal insurance providers to see if your student would be covered while they're abroad and to look into potential additional insurance policies as necessary. In terms of medication, we recommend that students bring any medications that they take with them and that they bring a full supply for their entire time abroad. They should carry that medication in its original packaging in their carry-on luggage with a copy of their prescription and or a letter from their doctor that outlines the details of that medication, such as the generic name, the dosage, anything like that. That's something that they'll typically need to show to customs when they are entering the country. And it tends to be easier for students to bring a full supply of their medication from home than to set up to get medication abroad in most situations. So talking again to your doctors about getting that full prescription is something to do as early as possible because that can sometimes take some time. And then finally, just encourage your students to talk to us if they have mental health or physical health needs that they want to be thinking about before they go abroad. We're here to support and provide guidance and advice on that. So they can always reach out to us if we can be any help. Go to the next slide, please. And then your students are going to be hearing a lot more about health and safety and wellness throughout their entire CEA experience, starting with that program orientation. So our on-site staff is ready and excited to welcome students. And in those first couple of days, they do a lot of fun welcome activities and orientation activities, including some specific sessions that are dedicated to health and safety. So we'll have one general health and wellness session that will talk about how to stay healthy abroad, what to do if you do get sick, how to find a local doctor, things along those lines. We'll, of course, spend some time talking about COVID, protective measures that are in place, how students can keep themselves and those around them healthy. If they are exposed to COVID-19, our staff will talk about where to go to get tested and what to do if they would need to quarantine or self-isolate during the semester. And then we'll, of course, spend some time talking about safety as well. So our staff will give students some tips on how to blend in and how to stay safe in their new environment and what to do if there is some sort of a problem, such as a stolen phone or a stolen backpack. Those things happen. Our staff is there to help support and will give students the information that they need to be prepared for those situations as soon as they arrive. Go to the next slide. And so speaking of our on-site staff, we have dedicated staff in all CEA locations. So no matter where your student is going, rest assured that they are going to be in good hands and they will have support right there in their same location. All of our staff are English speakers. Many of them have lived in the US and all have extensive experience living in their program location. So all of our staff that students will be working with have lots of experience working with study abroad students and are prepared to support your students however they can. Our staff are all trained and experienced in student affairs, in emergency assistance and crisis response. There is a 24/7 emergency phone line in each of our program locations. Your student will get that phone number during orientation. So if they do experience some sort of emergency, they will be able to contact someone who is right there in the same country as them, same city as them, to get some support on the ground. And then our staff are there as well for the non-emergency situations. They're there to support students for anything big or small. So they tend to be the go-to contact for general questions such as where to do my grocery shopping, or, I'm feeling homesick and like to talk to somebody, or can you help me explain this cultural interaction that I just had? Our staff are there to support students however they can, and your students will be getting very familiar with our on-site staff while they're abroad. Go to the next slide, please. Thank you. And then just a little general information about healthcare abroad. So if your students are going to see doctors or have an emergency appointment or something along those lines, students will typically be experiencing the private healthcare system in their location. Those are generally pretty comparable to US healthcare systems. We would work closely with your student and with CISI to identify a certain provider for whatever care it is that they need. So there's not necessarily a network as we're used to in the US in terms of finding a doctor and working with insurance, but CISI will provide referrals to specific doctors and healthcare providers based on what they've experienced has been helpful for students in the past and what makes most sense in your student's situation. Again, students will make the payment for any healthcare they receive at the appointment upfront, including that $25 deductible. And then they can file for reimbursement for those medical bills aside from the deductible. And again, our staff will be ready and willing to help students navigate that process. Students will have access to more information about their insurance as they get closer to the start of the program once they've been enrolled a few weeks before the program begins. We did recommend that students bring a full supply of their medication with them, but if something happens and they need to get a refill or a replacement, having that US prescription is going to be really helpful. Typically, your student would need to go and see a local doctor to have a new prescription issued. They won't be able to get that US prescription filled in a foreign pharmacy, but having that US prescription can be helpful for the doctor that they go to see to get an idea of what the student's medical needs are. If students decide not to carry on with counseling services with their current provider, or if something comes up abroad and they decide that they do want to see a counselor or a therapist, there is therapy available in all of our program locations and available in English. So if there won't be a language barrier for students to get their mental health care needs taken care of. There's therapy available typically in person, but if not in person, there will be an online option as well. It can sometimes take a while to set up therapy appointments and counseling appointments. So we would recommend that if your student's on the fence about whether or not that's something they want to pursue while they're abroad, it can be a good idea to just go ahead and set that up or be ready to get it set up sooner rather than later, just because it can take a little bit of time to find a counselor to make that appointment once they've actually arrived. And that's always something we can talk to your student about if they have questions or concerns and aren't sure what to do. And then for any other specialists as well, dermatologists, physical therapists, anything like that, whether your student needs to set up appointments in advance for continuing care or whether something happens abroad and they need to see a specialist, there are typically specialists available in every location, or depending on the location and the student's particular need. So again, if it's continuing care, have your student let us know as soon as possible so we can look into what arrangements are available. And if it's something that comes up, our staff will certainly work with your student and with CISI to find some appropriate healthcare for them while they're abroad. And with that, I will hand it over to Erin to talk a little bit more about COVID-19.
Great, thank you, Hannah. That was a wonderful overview of the healthcare that's abroad and a lot of the services that are available through CEA and the support that our on-site staff and our US-based staff provide for students also. So it's a very comprehensive program. And probably one of the things that's at the top of your mind right now is COVID-19 and what that means for a student who is studying abroad. And we've been fielding a lot of these questions for months now. And as we've been sending students abroad on our program since the spring of this year. So, so happy to talk about this for a little while. First, I wanted to explain a little bit about how we decide whether or not a program will run or whether or not a program will continue to run during a pandemic. And we have a dedicated team of individuals, both here in the United States and on our on-site locations, that review a lot of information regarding COVID-19 in order to make a good, solid decision as to whether or not we will allow a program to run. So a lot of the information we're looking at are governmental reports from the US Department of State, other foreign governments who are also looking and watching the COVID situation, a lot of health officials, the CDC, international health organizations. We're also looking at how many cases are appearing every day. What is the percentage of the population that's fully vaccinated? And most importantly, I think we look a lot at what is actually happening in our program location. So we depend a lot on our on-site staff to provide us with a good idea of what life is like and what life will be like for your student once he or she is abroad. So things like mask mandates, social distancing, is there full capacity in transportation or in classrooms? Can you get into a restaurant with a green pass? Can you basically live your normal life while you're abroad, or is there more of a lockdown situation where if you're a student abroad, you're not going to have that typical study abroad experience? So we take a lot of this information into consideration. We're constantly reviewing what's happening around the world to make those decisions as to whether or not we're going to run a program or not. And you can actually go to our website and see we have a COVID program information and a COVID FAQ page that has a listing of all of our current programs that we'll be running for the spring. So I definitely refer you back to that for a lot more information. One thing that we have also, we have a very long list of COVID-19 protocols that we've been reviewing and revising for really the past 18 months or so since the pandemic started. And we want to make sure that we're providing programs that will be safe for students, that will follow the typical protocols that we're seeing here in the United States, so that our program locations can continue to run and we can protect the health and safety of our students, of our faculty and staff, of the communities where we are operating. So you'll see things in our protocols, such as, for example, for our CEA buildings and facilities, we do have a mask mandate for anything that's happening indoors. We do have social distancing in place. If we're using a bus for transportation on a program event, we'll only have it at 50% capacity. In our housing, in our program housing, we have only 2 students who are rooming together. There may be up to 6 students in an apartment or 5 or 6 students in a homestay, but we'll only allow 2 students to share a room. And also on events and activities that we're doing with our students, we're trying to keep a lot of those events more outdoor focused. So we don't have to worry about taking our students to a crowded museum or an indoor location where you're going to be up against a lot of people and then have to worry about, will we be getting COVID on this trip? Hopefully not. So definitely trying to keep those events and activities outdoors. And if we are going to restaurants and different venues, we're making sure that all of those locations are following the local COVID protocols also. So there is definitely a lot of review. We work a lot on this to make sure that our programs are following those local protocols to keep our students safe. If you can go to the next slide, please. One of the biggest changes to our COVID protocols is that we're now requiring that all participants are fully vaccinated for COVID before they go abroad. And this is a requirement for the spring and the summer programs and going forward. So we started this on October 1st. And so we feel that this is an important decision to make, again, so that we can protect the health and safety of all the participants on our program. And also so that we can continue to protect our faculty and staff and those communities where we are. We feel like we want to do our part and make sure that everybody is vaccinated, and it really makes life a lot easier for students also when they go abroad fully vaccinated. A lot of the restrictions and requirements in the countries where we host programs are a lot stricter than they are here in the United States. And those regulations and restrictions change pretty quickly. We've seen over the past couple of months where countries where you didn't really have to show proof of a vaccine to gain admittance to a venue, they're now requesting that. And if you don't have proof of a vaccine, then you have to take a PCR test in order to gain admittance. And so it really makes life a lot easier for students. PCR tests abroad can cost a lot of money. They're not free like they typically are here in the US. And so it just helps the student be able to budget better and live their life in a typical fashion instead of having to worry about that. So students will have to be fully vaccinated, and they'll have to submit a copy of their CDC vaccination card or equivalent to us before they leave for their program. And we are allowing for some medical and religious exemptions to the vaccine. So if your student falls into that category, we do have a form to complete, and your student can contact me and I'll pass along that form for review. And it's always important to check entry requirements for the countries where we operate or the countries where your student is wanting to go abroad, because we've seen, like I said before, they have changed quite a bit over the past several months. And here on this slide, you'll see some links for some helpful resources to help you find where that information is. You can go to the next slide, please. This is a big question. I'm sure it's probably a bigger question for you as a parent or a guardian than it might be for your student. But what happens if your student tests positive for COVID or believes he or she has been exposed to COVID while abroad? And I feel like the first thing that the student should do really should be to contact our on-site staff. Hannah and Kayla have already talked about our on-site staff. They provide so much support and guidance for our students while they're abroad. And it is hard to remember everything that you're supposed to do once you get there or once you get abroad. And so letting our staff know what's happening is definitely the first step. And our staff can let the student know where to go to get tested if they haven't been tested yet, where to go to get medical care, what the regulations are for self-isolating. Also how to, get their classes online so they don't have to worry about leaving their apartment or housing to get to class, how to get food delivery. And also we want to know so that we can do some contact tracing so we can get in touch with anyone who the student has been in close contact with to let them know that they probably should get tested. In terms of insurance, if a student is symptomatic or believes that he has been exposed to COVID, typically the insurance covers the cost of the PCR test, and any sort of medical care that would be needed would also be covered with the insurance. So it is a very comprehensive plan. And then Hannah alluded to at the end of the program, if your student is, if you have to get a test to get back on that plane, and if your student tests positive and has to quarantine in country, then the insurance does have a quarantine coverage up to a certain amount. And so that can help out with those costs of having to get a hotel or pay for food for the additional days that they have to quarantine. Next slide, please. And a few tips in preparing for COVID or preparing to study abroad during a pandemic. Please encourage your student to get vaccinated if they haven't already and submit their vaccination card to us. And we need those vaccination cards at least 30 days before the program start date. It's also a good idea to purchase a few additional masks for your student to take with them on the airplane. They can purchase masks abroad, so they don't need to take a full supply for the whole entire semester. But it's just nice to have a few extra ones. The plane rides are long, and so it's probably nice to have a fresh mask for halfway through the plane ride or once they get to their program destination. The entry requirements, I know I've said this a few times already, but it is very important to be familiar with the program destination entry requirements as they do change. We try to keep everybody as updated as we can, but we definitely want your student to know what those requirements are and know how they will affect them before they depart for their program. And then again, to review, we have a lot of FAQs on our website, a lot of information about COVID and what it's like to study abroad in a pandemic. So I'll refer you back to the website too for some more information there. Okay, next slide, please. And in case there ever is an emergency, like Hannah and Kayla said, our on-site staff are available to support students at any time. And, if there's something going on during a regular business day, they can contact our staff at the office. if something happens in the middle of the night or on the weekend, then there is that 24/7 emergency phone number that the student can call to get support and guidance for what they need to do. And they'll receive that phone number during the orientation once they get on site. And if they would happen, a lot of times our students will forget that, they have that number, and they'll call you instead and let you know that their wallet was stolen or their passport was stolen or they were locked out of their apartment and they lost their keys. And so if that would ever happen, you can always call our emergency number. That's our 800 number listed here, which will take you to our Phoenix headquarters. And we have a US staff member who is on call 24/7 also. So you can call that number, and then we will get in touch with our on-site staff so that they can assist your student. Or if your student does call you, you can always encourage them to call our on-site staff. They should have that number with them. So, but you can always call this number too, if you need to. And we do have, unfortunately, we do have quite a bit of experience in handling different emergencies that happen abroad, from smaller emergencies to, if a student has to go to the hospital, to larger emergencies. Say there is a natural disaster like an earthquake, or if there would happen to be a terrorist attack, or if another pandemic hits. We have a pretty well-oiled machine with a crisis management team that's based out of the United States. And the crisis management team works very closely with our on-site staff to help guide what that crisis response would look like. And so our on-site staff will be attempting to locate your students by calling them or texting them to verify their safety, to see if they're okay, to provide them with emergency instruction as to what they need to do in that moment, and then to continue to follow up with them until the crisis is over. And what we do here in the United States, along with working with our on-site staff, we work with an emergency assistance team that's called AXA Team Assist. That is through our insurance company. And they help set up a lot of the logistics for any crisis response if there would be a situation where we would have to get students out of a country and bring them back to the United States. And then another critical piece of that is communication with you. So we will be in touch with the student's emergency contact should there be an emergency event, and let you know what is happening, the steps that we are taking, and how your student is doing. And we also communicate with their home institution also to let them know what is happening. The emergency assistance team that we work with, they help us in terms of crisis. They also help students if they have any sort of emergency while they're abroad or if they're traveling. I know they help out a lot if, say, your student is studying abroad in Spain and travels to Italy. And during that time, your student's backpack is stolen and they lose their passport and their wallet. Your student can call this AXA Team Assist, and they will help give instruction on what to do to get a new passport. If their credit cards or debit cards were stolen, they can even provide some emergency funding, some emergency cash, so that your student can pay for a hotel or whatever expenses they have until they can get money from somewhere else or get their credit cards. So they do a lot of really neat things for students, especially when they're traveling and abroad and don't have access to our on-site staff. And I think, let's see. Yeah, Kayla, I think the next slide.
Sure. Thanks, Erin. So just to reiterate a couple of top tips for while your student is abroad, some things that the enrollment team will share with them as they're working through their pre-departure really orientation or just process in general. Again, of course, referring students back to on-site staff for assistance should you hear from them. They're the ones that are on the ground. They're the ones that are going to be able to help out immediately. So just making sure that we always refer them back to those resources they have in the city. Definitely, talk with your student before they leave about setting up some kind of communication plan. We definitely see a lot of the time that students are a little bit less frequent when it comes to their communication, so they might not call or text as much as they might here in the United States, or very much at all. So what I recommend a lot of the time is, hey, let's do a FaceTime every Sunday for, half an hour or an hour, just so we can catch up. So you have that open line of communication with your student, and you're prepared for that, communication to be a little bit different than it might be here in the US. Certainly important to keep a copy of your student's passports, their ID, any kind of credit card or debit card numbers. Helps in case, you know, something gets stolen, they might need additional help, they might need additional resources. So it's good to have that on file here in the US as well. It's important that you don't necessarily mail anything when it comes to medication, any kind of technology or phones. So say a student, you know, does get a phone stolen in some case, it's really important that you don't try and send one through the mail. It's likely that it would be confiscated or possibly stolen, stopped at customs, things like that. And again, that's what our on-site staff is there to help with. So using those resources on site to replace those items if needed. And then medication also likely will get stopped. So making sure they chat with their medical professionals or providers here in the States, as Hannah alluded to earlier. Also, as you know, parents and support systems here in the States, make sure that your passport is valid and that you have a COVID vaccine. You know, knowing what the entry requirements are in case you did need to travel or if you're planning to travel to visit your student while they are abroad.